palliative care and long-term care really comes down to person-centered care. It isn't just about death and dying, but it's about preparing residents and families and the team as to what this individual would have wanted or wants and desires for their life to look like if and when that end becomes more near. Up until recently, long-term care was often a place where individuals moved out of choice. They sort of had the option of downsizing and making some, last chapter of life planning and decided, well, I could go to a retirement home, I could go to assisted care, or I could go to long-term care. So they used to be healthy, and so the conversation around the end of life wasn't happening as actively, and it wasn't needed as actively. Nowadays, the average life expectancy of an individual who moves into long-term care is 18 months. And that's not a lot of time to really plan a new chapter of life in this new setting. So the conversation around what could happen in the context of the higher possibility of end of life being part of these experiences for the individual is making it so that there is that need to talk about what the person would want the end of life to look like in this setting, and hopefully help them transition as little as possible in the system, because transitions in the systems we know lead to poor quality of life. That emerge transfer back and forth to the hospital and or rehab, it does not lead to good quality of life, because it means that the person is moving from a setting where they're known and their wishes can be respected in a more personable way to a place where they have to wait. It's all about testing, and it's really about the medicalization of the last chapter of life. That's a phenomena now that we see and we talk about. So we're hoping that by having an active conversation about end of life, but maybe just the last chapter of life and what that might look like in long-term care, would help reduce these unnecessary transitions and the unnecessary medicalization. Of course, when it's appropriate and it meets the person's goal, then that's absolutely what needs to happen. But it's really about bringing all of this together and talking about the options. So if there is one word I could really choose to define palliative care, it should really be about option, which is the opposite of what many individuals and families think when we use the word palliative. It's almost like it's no options. It's just about death and dying. Well, it's actually quite the opposite.
Initially, when people hear the word palliative, we always think death, right? Yeah, but over time, as I got more education, I realized it's not just about dying, or it's about making talking to the residents or the patient or whoever or your family, and how they want to experience their life moving forward. Do they want to be transferred to the hospital? What is quality life for them? So I began to understand those things. You just have to talk to them and ask them what it is they want for their life, like what their plans are, what their wishes are. So that to me before, it's like, okay, they're here, and yeah, this is what we have for them. This is how we've always done it. But no, we want them to be more involved. We want to ask them about what they want to do with their life. So now it's a different kind of mindset, and people are being more understanding. So now when you talk palliative, you don't just say, oh no, does that mean that, oh, my dad or is dying? No, it's not. It's not all about that.
Every conversation I have is different, and it goes to show how important it is to just sit in that space with what the individual brings to the conversation in terms of questions, uncertainties, fears, and values. I always go into these conversations with so much curiosity, because I'm often surprised. Some families come in and they say, we want palliative care because we've seen how wonderful it is, and this is what we want for mom or dad, or for myself, if the individual is capable and I'm having a conversation with them. So this is actually one of the things that I love the most about my job, both in long-term care and palliative care, is that there's just so much getting to know each other and kind of the team environment and the home. It's their home when they're moving here with us. So it's important that we bring them on board into that home and make them feel that this is about a two-way understanding. And that's kind of the beautiful thing that could happen as a result of these conversations. And sometimes you leave with more questions, and then it's a reason to go back.
We're here, we're their family, we take care of them. So we notice every minor detail about them. If they're not happy today, well, in the past 3 days, how are they eating it? We notice all these like small changes in them. So we call them and we update them, and if they want us to meet with the whole like different departments, usually when there's like a significant change, we call it, and maybe it's time we do this meeting.
One thing I have learned very early on in doing this is how much, for example, the frontline, like the personal support worker, knew about the person's values and wishes that I, as a physician, didn't. And that's because of the dialogues and the conversations they're having on the day-to-day basis as they provide care are very personable. Whereas, sometimes the higher level medicalized conversations weren't tapping into some of these personal elements of care. So it's so important that every team member in the home understands that because they're involved in the person's care, they are part of that person-centered care. And because of that, they are part of this philosophy of care. And so empowering them to understand the potential of how their work and understanding of the person could change their care is really key. And I often find when that happens, that there is a culture change, and then they're teaching me, they're coming kind of to me or the administrator to say, this person really needs more in this area, or the family were here and they just sounded like they were really unsure about what's happening. Can we have a care conference?
What I can say is we're very involved. We did a lot of education with our PSWs, so they know what are the signs to watch out for, like as soon as they notice anything different, so they let us know right away, like, oh, she didn't eat, like she was only eating 0 to 25% in the past day. Let's see. So they communicate. The important thing is we communicate. So how about the activation staff? What do they observe? What do the nurses observe? Like there's something different about them. So they're always like aware, like they have this consciousness, and they know the residents. The residents, they're our family. So we know them. If there's any little change, we notice and we communicate right away.
The importance of having a team is that everybody work together to make sure whatever needs to be done for that resident, for the palliative resident, is done. So, for example, let us say the doctor is not around, but we're there, or the registered nurse is there. We can always tell her, this is what happened, or we noticed this, notice that, so they could deal with it, or call the doctor and let the doctor know that, this is happening. It always comes back to we as the frontline workers, we are always the last one there with that person. But teamwork is great because it makes it easier.
As we're doing this work and the culture change takes place on the ground, I think the outcome of what that looks like is actually quite incredible, and people start to sort of just own it and do what needs to be done.
Yeah, I think like more and more people should do palliative care. It's something that everybody should think about. We have to be realistic about it. We're all going there, but I think it's the way you present it to them. Like it doesn't have to be a bad thing. It is a good thing because it's all about being comfortable, like making the rite of passage like smooth sailing, and giving the residents or our families what they want when they're at that stage.
There are so many things I like about my job now. There's a lot of things I love about my job. You know what I mean? I just like caring for the elderly. I just like caring for. I like caring for the elderly because it's like you learn a lot from them. Those that could actually communicate with you and talk about the things that happened in the past and things what you should do, because they usually give advice. A lot of them, it depends on again, it depends on who they are. They would give you good advice. So you learn a lot from the elderly. They're wise, they're older, so they're wise.
Not everybody can do this job, but we love our residents. My grandparents raised me, so yeah, this is my way of honoring them, like giving back to them. I know wherever they are that they will be so proud of me. They're my grandparents too, they're my parents too, right? Like they're family to me, so I love doing this job.